Hello, my name is Margaret Delmastro. I'm one of the nurse practitioners on the palliative care team here at St. Joseph Hospital. I am here today to talk about the California End-of-Life Option Act and the St. Joseph Hospital system response to that law. In June of 2016, the end-of-life option became law in the state of California. This law states that any patient who has a terminal illness, has been deemed to have a life expectancy of less than 6 months, and is competent, she or he may enter into a relationship with a physician to obtain a lethal medication to end his or her own life. Again, the patient must be competent and able to take the medication themselves. The law states that 2 physicians must be consulted. 2 people must sign a document stating that the patient is who they are, they do have the illness, and that they are entering into this relationship freely. 48 hours prior to taking the medication, the patient must again return to the doctor's office and sign a final attestation. According to this law, both the patient and the physician must enter into this relationship freely. There are criminal penalties for violations, especially if coercion can be proven. A physician who refuses to enter into this relationship due to conscience, religious beliefs, or ethics cannot be prosecuted. The St. Joseph Hospital system has opted out of participating in this law. What does this mean for the patient and families? What this means is that the St. Joseph healthcare system is asking its physicians to enter into compassionate, understanding conversations with the patient, trying to uncover what unmet needs might be present. Here at St. Joseph, we believe that the dying process should be compassionate. It should not be prolonged or hastened in any way. We believe that patients asking about the End-of-Life Act may have symptoms that have not been managed, symptoms of pain, nausea, vomiting, constipation, or perhaps spiritual concerns, depression, anxiety. Perhaps the physician needs to consult the palliative care team, psychiatry, social work, perhaps hospice, and of course, spiritual care. The patient needs to know that the physician will never abandon them. As always, it's about the patient-physician relationship. Like birth, death is a process. Amazing things can happen during that time. Patients and families should have the opportunity to communicate and have some closure. They may have the opportunity to say things like, "I love you," "Forgive me," "I forgive you," or simply goodbye. I feel proud to be a nurse practitioner at the St. Joseph Healthcare System. We at the Center for Prevention and Treatment of Cancer at St. Joseph Hospital are committed to quality care at every stage of life, including that final journey. Thank you.